in emergency medicine, we have to have this breadth of knowledge. We have to know, a lot of people think we have to know a little about everything. And many times we need to know a lot about everything. Emergency docs, we know deeply how to care for somebody in many emergent conditions for the first several hours. But once it gets past the first several hours, we may not be as well versed in what to do. We know a lot about kind of uh, the bread and butter issues and even some of the zebras, how they present. Um, but AI can help you to find those patterns and to recall that what's the third part of this triad? I think this patient has this rare condition. Let me refresh my memory. So it helps with each individual patient. The other thing that I see that it can do is really help to standardize care, because now the doc that's been practicing for several years who may not be quite up to date can look up to see what's the latest guideline or what's the latest literature say on a particular condition, its diagnosis and treatment. So it really helps to get the new doc, the older doc, the engaged doc, and the less engaged doc up to speed and on the same page. And the potential is there to make decision making much more standard, much more reliable from clinician to clinician using AI. We've used a tool, trialed it in our system a year or so ago with decision to admit for acute heart failure cases. And even with somebody like myself that tends to really like to use clinical decision-making tools, whether it's just a calculator available on a site or it's just something from one of our texts, um, the the ability to do that within the EMR and to use AI, I think makes it much easier. An internet search is essentially like the Family Feud, right? It is survey says it's just looking to see what's out there and putting it up on the screen. But using an AI tool that has that large language model in it and is trained appropriately, that's a lot more like Jeopardy. And so you're getting a more definitive answer with some provenance behind it. So you can make sure that the answer that looks right is really likely to be right. I think there's a misperception among patients, and I think there's a little bit of a bias that or misunderstanding as well with docs that somehow we know everything we're supposed to know when we finish medical school or residency, and that we should have this huge repository of the medical literature. And so um, it's pretty erroneous. We really need to be using AI to allow us to be using the latest information, to be integrating the information that's in the chart. Right? If we have AI that can read the chart for us, um, we can really use that to make better decisions by not having to comb through a ton of information that's in the chart that may be extraneous or not applicable to the situation that we're dealing with. I think we do need to get over um, some of the qualms and misgivings that people have about using AI as an adjunct, right? It should never, and I don't think it can ever replace the clinician. I think it can only I think it should only be used to augment what we have. We're going to need to do some training with docs of all experience ranges to make sure that they can critically evaluate the answer that's being given to them and to make sure that it's truly applicable. So one of the things that I felt was weak in medical education in general is teaching us how to read the literature. And so this is kind of an adjunct to that or corollary. So that's going to be one of the things that we're going to really need to work on. And then it's going to be the attitude of physicians to the use of AI. So, huge hurdle that we need to get over within the medical community, even before we can push that out to patients to make sure that they understand how we're thinking to make sure we're giving them the best care.